Now, this issue of the nervous system becomes incredibly important to men who have prostate cancer. What I've drawn here in green on either side of the prostate gland are the parasympathetic nerves that are responsible for erection. The sympathetic nerves are nowhere around there. They don't touch the prostate, they're not on the prostate. I mean, they're in the same body, but they're not close, surgically close. Believe me, a centimeter away is plenty far away. But the parasympathetics, they're literally right on the surface of the prostate. And it is the parasympathetic nerves that are responsible for erection. So, if your patient has to have his prostate gland out for cancer, he may lose those nerves. When I started in this business, we simply told everybody who was going to have his prostate out, you are going to lose those nerves and you will never have another erection. And there were plenty of patients who said, then I don't want the operation. I would rather die of cancer than lose the ability to get an erection. And they wouldn't sign a consent. Now we have an operation called a nerve-sparing prostatectomy, where we do our best to retain the nerves. Nerve-sparing prostatectomy is not perfect. Well, how perfect is it? If you do a nerve-sparing prostatectomy, 60% of the male patients will get an erection adequate for intercourse a year later. And you have to give them the entire year, because the amount of swelling involved in getting that prostate out and fooling with those nerves, the amount of swelling is such that it can take a full year for that swelling to resolve. And until the swelling resolves, they're not getting an erection. If a year goes by and they haven't had an erection, they're not getting an erection. And that happens to 40%. 40%, even if we do a nerve sparing, 4 out of 10 will never get another erection. Now, I didn't say anything at all, did I, about ejaculation. Because ejaculation and orgasm are sympathetic. Now, in your guys' experience, you have probably never seen a male ejaculate who didn't have an erection. But in fact, it's perfectly possible. I've taken care of many, many young men who came back from Afghanistan or Iraq who got blown up. And as a result of their injuries, they lost the parasympathetic nerves down in their pelvis. They were never going to get another erection. But their sympathetic nerves were intact. So if their spouse used manual stimulation on the flaccid penis or oral stimulation on the flaccid penis, penis does not need to get erect. After adequate stimulation, the man will have an ejaculate, and he will have an orgasm, and the orgasm feels exactly the same. So don't mistake the neurologic issue. Parasympathetic nerves are what's essential for erection, just erection. The sympathetics for ejaculation and orgasm.